still on my screen. Thank you for joining us. In your upper right-hand corner, guys, gals, I'm sure you already know these things, but I'd like to cover it anyway. Little orange arrow button up there. If you have questions as we move through there, go ahead and type your questions in, and that way at the end of the webinar we'll have most of the questions answered. I got a young man by the name of Todd Weiss on the other end. He's very good at answering all the questions, and if we have any that we need to read back at the end, we will. So again, thank you for joining us. Talk a little bit about IAC as a company. It's a B+ rated company, which if you look at the bottom it says very stable outlook. The company has been in business over 50 years. They started out as an insurance agency, and most of their business was coming from the Pacific Island nations and territories. They were doing a lot with life insurance, accident, little supplemental accident products, and they were supplying that to individuals and groups. So they got into the Medicare Supplement market. They contacted us here at Heartland Financial Group. The owner here knows the owner of IAC extremely well. They started talking, and one thing led to another. Struck a deal with a reinsurance company, and here is a new Medicare supplement for you to offer your clientele. Very, very good back office in Salt Lake City, Utah. I think the best in the business to admin the business, and things are really, really starting to take off. And we appreciate you if you have already written business. If not, hopefully you'll see some things here today that will make you want to go ahead and sell the IAC product. So let's go ahead and get started and talk a little bit about what we want to talk about here today. There's some things here that I think gives us a very good advantage as salespeople out there in the sales field. First off, we have the competitive data that we will show you the map where this product's available, and discuss our household discount with you, show you how and where that applies. It's almost identical in every state, but there are a few states that made us make some changes. We'll cover that here shortly. Give you some tips on how to submit new business, and things that we are getting a lot of good feedback on is our bonus program. We had an agent call the other day, said I got a check in the mail. I didn't even realize I was going to get that, and she received a check for over $400. So, guys, we're really gonna talk a little bit about the bonus program at the very end and show you how you can capitalize on that. And then at the last slide you'll see is the contact sheet for the different departments for the company. Okay, so with that said, let's go ahead and look at the map availability. Anything in green is currently approved and taking business. We still have Minnesota and California and Virginia yet that has not been approved. Hopefully those will come on here real quickly. And if you're looking in the yellow states, you'll see that those are not filed and may not be filed. So I think Michigan will come on sometime later this year. We'll get a lot of calls up there. Are we going to get in Michigan? The answer is yes, just not for sure when that product will be filed up there. But anything in the green, business is coming through the door. Very, very good business is coming from a lot of different states, very competitive rates. You'll see those shortly. If you look at your map, there are 4 states that don't have the standard only one person need apply to receive a discount, and I'll go over the discount more in detail when we move here. But if you look at Ohio and New Jersey, in those 2 states, 2 people have to apply to get the discount. In the state of Idaho, then there is no discount. We decided instead of making 2 people have to apply to get the discount, which would affect, not everybody's going to qualify for that, we just reduced the base rate about 4.5%, and that way everybody gets a lower rate. But in New Jersey and Ohio, those 2 states, 2 people have to apply, be approved to receive the discount. In the other green states, then only 1 person need apply to get that discount. So that is a very, very good offering for our people in selling our product. Okay, take a look at the rates. Utah, a couple of things I want to point out before I go too far into this. Look at a couple of different areas on each one of these slides. First off, you'll see that at the very bottom it says rates are based on a Plan F. Female, age 67, non-smoker in the lowest area factor. Only 1 person need to apply in order to receive that discount. So why am I not showing age 65? Because age 65, our rate is the same as it is at age 67. Age 65, 66, 67 are the same. We wanted our rate to be a little higher at age 65 than maybe some of the competition out there, because after selling Medicare Supplement insurance for 31 years, I can't tell you how many times that when I'm talking to somebody turning 65, when you're sitting there talking to them and when you're filling out your discovery sheet to find out what kind of health conditions they have, things like that, what kind of medicines they're taking, something comes up in the conversation like, well, you know what, I'm going to be 65 in 2 or 3 months, and I've had a hip that's been bothering me for about 2 or 3 years, and the doctor said I'm going to have it replaced, but I got a $5,000 deductible on my major medical, and I've lived with it for this long, another couple months ain't going to make any difference. Once I get on Medicare, I'll then go get my Medicare supplement, and I won't have to pay anything out of my pocket. So those types of stories I've heard countless times in 31 years, something similar to that, you know, people not going to the doctor because they got a big deductible on their insurance plan and they want to get it paid for by Medicare and their supplement. So we're trying to get away from that so that we can maintain a good stable rate with our product offering, and that way you don't have to go back in 2 or 3 years and say, oh, that thing went up 25 or 30%, and we can maintain what's trend or below rate increases, because all companies have rate increases. So that's one thing I want you to understand. All these rates are based on an age 67-year-old female, non-smoker, in the lowest area factor in each one of these states. That's the way all of these are competitively priced out. The next thing I want you to look at when we go through these slides are the effective date. Look at Manhattan Life. They're sitting in the #1 share. They're at 113.50. If you look at Oxford, they're at 114. Central States is at 118. And then you got Stonebridge and IAC at 118 and 121. Well, look over on the right-hand side on the effective dates. When you look at the effective dates, how long do you and I think Manhattan and Oxford and Central States can continue with a price that they haven't had a rate increase on in almost 2 years? If you've been in the mid-sup market for any length of time, you know it's coming. You just don't know how big it is when it comes around the corner. So that's all I'm getting at, is I want you to pay attention to the effective dates, because if you're looking at a Manhattan or an IAC, and Manhattan right now is $8 a month less, if they don't get a discount, then we're actually not quite $1 less than they are. But when you look at that and you're talking to your policyholder, which one of those companies do you think is going to go down the road without a rate increase? And who knows, if a company hasn't had a rate increase for 2 years, I've seen pretty healthy rate increases in the 15 to 25% range when they do things like that. So we want to avoid that. You know, that causes you a lot of headache when clients start calling and saying, hey, that thing went up 25%. That's a pain. I've had companies do that in the past. So pay attention to those 2 areas as we move through here, and I think you'll see we've got this thing priced in a pretty good marketplace for you guys to go out and do a lot of good business with us on the med-sup side. So in Utah, we're coming in at $121.19. We do offer a one-person applied discount. Throw that in there. That puts you very competitively priced at $112.71, and I can't guarantee you anything, but I would about guarantee you that we won't have a rate increase before the top 3 up there. So with that said, let's move right on. Kansas, great rate in Kansas, guys, $126.76. We came out about the same time as Manhattan did. However, we do offer husbands and wives, and it's a household discount. It's not just a husband and wife. A 7% household discount. That drops us down to $117.89. Again, only one person need to apply. Guys, we've got a tremendous good rate in Kansas, getting a lot of business coming out of Kansas right now. In Missouri, at age 67, we're at $145.56. Most companies are higher than that at age 65. Very, very competitive price in the state of Missouri. If you run into a household discount, that drops us down into the $135 range, and there's nothing in the state of Missouri that I know of. That's my domicile state, pretty well up on the market in Missouri. You're not going to find anything any less in the state of Missouri at age 67. When you throw that household discount, you're down at $135. So great offering. We introduced that in January of this year, so things are starting to come through the door in the state of Missouri. Very good offering there. South Dakota, Not a very big state, but that's another state. I don't have time to go through all the states that you've seen in green on that map, so I'm just throwing out some out here for people to look at, trying to give a different mix throughout the country. In South Dakota, Manhattan's at 113.25. They're coming up on 1 year on that rate. IAC's at 118.41. When you throw that discount in there, we drop down to 110.12, and that's a very, very competitive product. Again, only one person need apply. Texas, one of the states where we're getting a tremendous amount of business coming through the door, and we are paying out a tremendous amount of bonus program money every month in the state of Texas, and it is growing by leaps and bounds. If you look at the top company up there, Heartland National Life, which is a company that I also work with, IAC's at 119.80. Throw that 7% discount on there for either one of those two companies up top, and you're looking at a price of $111.41, guys. In the rural outlying areas of Texas, that's extremely, extremely competitive. If you're in the Houston market, we're not in the #1 share, but that's okay. We didn't want to be in the #1 share in the Houston market. But anywhere else in the state of Texas, that product is very, very competitively priced. And when you consider, excuse me, some of the other things that we bring to the table that we'll talk about here shortly, there is a lot of good reasons to put IAC in your kit and present that product to your policyholders. Okay, one of the things that I try to get agents to look at, and when you go into a house, #1, your main objective, if you can help people, is to market a product to them. If it's not in their best interest, your objective is to thank them for the time and move on. But there's several different things going on in the market. The Plan F has been the most popular product sold over the years. Plan G is now really starting to get some traction. My mother has a Plan G and has had for several years. There's reasons why we think Plan G is a good buy. We're going to do a webinar on a Plan G offering here pretty quick. If you get time to tune into that, you should. But anyway, Plan G, the only difference between your Plan G, as you guys, most of you already know, and a Plan F is a $147 Part B deductible. That's a once-a-year deductible. So if you're showing somebody a Plan G in June, chances are they've already met their deductible for that year. So it's identical to a Plan F if they've already met their Part B deductible. But here's kind of what I want you to take away from this. Let's say that you go into a household and you're talking to a man and a woman, and they have a Plan F that's higher than our IAC Plan F or any product that you're selling. But it's not a lot higher. Say it's just for simplicity, say it's $150 a month, and your Plan G is $140 a month. Well, if they've had that Plan F for any length of time and they're very comfortable with it, they're probably not going to make a change for $10 a month. I mean, some people will, but a lot of people won't because they're already comfortable with their product. They know how it performs. So $10 a month, they may not be interested in making a change. However, you can either fold your tent and move on to the next opportunity, or you can actually educate them, and there's several ways of doing that. I always use the outline of coverage to lay it side by side. I got it highlighted, Plan F, Plan G, and then what difference is the one little box. Ask them what that little box is. They don't know. You show them it's $147. Throw a couple examples out there. They see that it basically is the exact same product, but now they're paying $150 a month, and you can drop them down to maybe $120 a month. Or if they get the discount, down to $111 a month. Now, $150 to $111, now you're getting into almost $40 a month. You take that times 2 people, that's $80 a month. Now you're talking almost $1,000 of difference in an annual premium for 2 people. And my closing question is, Ms. Jones, if I can save you, $500 for you and $500 for your husband, would you be willing to pay $147? Would you, if I'd give you $500, would you give me $147 back? Absolutely. They'll do that all day long, but you've got to educate them a little as to why that is a good benefit. And then you can go into things like, the stability of a Plan G. Is it staying more stable in rates traditionally because you get away from the guarantee issue? You can use your healthcare buyer's guide to show that Plan G is not a guarantee issue product. Education's all I'm saying. Educate that policyholder to let them know if you have a Plan G and you got $100,000 to pay a bill for $100,000, if you had to pay $147, would that break you? Probably wouldn't, would it? Just little things like that. You can sell a lot of Plan G, and you are not doing a disservice to that policyholder. Plan G is a very, very strong plan. Anyway, so IAC is coming in at 120.09, Western Catholic Union's at 114. Both were introduced, well, Western Catholic Union's coming up on 2 years with that rate, so you know that's going to tick upwards, just like Stonebridge at 118. You know that's got to go up. Probably go up in June in Missouri, be my guess. That's about when they went up last year. And then you look at us at 120 with a January 215 now offering, and throw that 7% household discount in there. We're in very, very good shape in Missouri for a Plan G offering. In Pennsylvania, the Plan G is extremely competitive. We're looking at 108.11. Sentinel Security also has got a strong product out there at 1613. However, we're going to talk about some other things that give you an advantage in the sales field. Throw that discount on of 7% in there. You're going to see us and Humana and Western Catholic Union right about the same ballpark, about $100 a month. Good rate. Standard Life and Accident is at $90.93. They have a 5% household discount. IAC's at $95.15. We have a 7% discount. If you figure both of those in, they're about 50 cents less than we are. So still both very competitively priced in South Carolina. We're getting a lot of business in South Carolina. Take that discount off of us, that throws us down to about $88.90 in Texas. Now, if you do the same scenario, Standard Life's 96, IAC's at 97, 87. They take a 5%. We have a 7%. That gives us about $1 advantage. So basically the same price, guys. What determines which plan that we think you should choose is what do we offer outside of just a good competitive rate. So we're going to talk about that here as we move forward. Okay. If you have any questions on any of these rates, I think I got New Jersey on here also. Plan G in New Jersey, we're in the driver's seat before the discount. We are starting to see a lot of business come out of New Jersey. We're at 132.47. If they qualify for the discount, that drops us down to 123.20, and that's a very, very competitive rate in the state of New Jersey. Utah is another good Plan G state for us. We are coming in at about 99.01. Throw that discount on there, it drops us down to 92.08. Utah, not a very heavily populated state when you get outside the city markets, but we are still getting a lot of business out of Utah. Okay, going to move right on to the application. And guys, I'm really going to go through this pretty quick because we're going to cover the application as how it applies to the Telephonic app that we're going to talk about here shortly. Basically a very easy to fill out application. Unlike some of these companies out there, you get everything jumbled in. You can see that that app is very well laid out so that you can fill in. You don't have to fill in any of the little squares or anything like that. Like some companies make you do, or darken the circle. I hate that. It's like, give me a break. So part one is all the personal information. Part two is plan selection. As you can see, we offer A, F, G, and N, and guys, this is state specific. There are a couple of states out there that require us to sell a plan B as in boy and a C as in Charlie, so your offerings will always be in plan 2, but just most of the states are A, F, G, and N. Part 3 is your eligibility, talking about when they were covered for Medicare A and B. It goes into their current situation. Do they have a number 3? If you look at number 3, that's a plan from like original Medicare, Medicare Advantage. If they answer that yes, then you know 4 and 5 will be no. If that's a no, then you move down to question number 4. Do you have another Medicare supplement policy in force? If they answer that yes, then 3 and 5 will be no, and so on. So number 5 is if they're coming off of an employer group plan. So that's just their Medicare information and their current insurance situation. Want to cover this real quick with you. If you are doing a telephonic enrollment or an online express application, which we're going to have available here for you real quick. We'll talk about that a little bit more in detail. Make sure that you read Part 5 of the general information located on page 3 of the application. You will be asked that by the underwriter. if you're doing a telephonic call, and they will also ask that a lot of times to your policyholder. The correct answer is always yes, and here's how I cover this. I'm sitting there face-to-face with one of my policyholders. I'll say, well, Mr. Jones, first off, they're going to ask you this when we call them, and you'll need to say, yes, I did go over this with you. You do not need more than one Medicare supplement policy. I think you're already aware of that. If you buy this policy, you may want to evaluate your existing health coverage and decide if you need multiple coverages. The only two coverages you should have for your hospital and doctors is original Medicare and this Medicare supplement. And then you may be eligible for benefits under Medicaid and may not need a Medicare supplement policy. So if you ever become eligible for Medicaid, you need to call me and I will guide you, and that's what 4, 5, and 6 pertain to. So make sure that I'm going to leave this with you. Make sure you read that. If you ever become eligible for Medicare, I want you to get a hold of me. There's a lot of different options available for you if you ever get on Medicaid. Now, if I'm sitting there talking to somebody sitting in a $200,000, $300,000, $400,000 house, I'll make a joke about that. So I'm pretty sure unless your wife's got really bad spending habits, or you have really bad spending habits, one or the other, you should never be on Medicaid. This shouldn't apply to you. You kind of make light of it, but you don't have to read that word for word. Just make sure that you cover it with them and that they know when they're asked, yes, it's the correct answer. Part 6 is your guarantee issue eligibility. That gives you each state-specific scenario, so it'll be different from state to state. All states have different issues for guarantee issue eligibility. Part 6 continued on this page. There's a couple of extras up there. Part 7 is your household premium discount. Part 8 is your premium payment and admin. How do you want to pay it? Do you want to pay it for 1 month, 3 months, 6 months, or by the year? If they pay it monthly, it has to be monthly bank draft. We do not have a monthly direct billing. Most companies have moved away from that because of the loss ratio on that. It's very loss heavy when they do a monthly direct billing. So you can fill all that out. In the middle section right there is your initial premium if they are paying premium. If they just want to submit a bank draft, they can do that. We can do it any way they choose to do it. We will do that for them. So they don't have to submit any premium. Just so if you look right there, it says draft initial premium on what date or draft immediately. So, let us know what you want to do. We will work with you and your policyholder. Make sure that you request an effective date and select a bank draft date, anywhere from the 1st to the 28th. So, and check if they're doing bank draft that they authorize the bank draft payments. Now, I'm going to blow up this household discount so that we can cover that a little bit more in detail. A lot of people think that this is just a husband and wife discount. It is not. It could be two brothers, a brother and a sister. Just two adults in the household is all we require. So it doesn't have to be the husband and wife. If you read that question, it says you may be eligible for a policy with a lower rate based on your answers to the following questions. Do you have a household resident of at least one but not no more than 3, and with whom you continuously resided with for the last 12 months, or with whom you reside or to whom you either married or have a civil union partnership? So a couple of examples here. You're sitting there talking to a guy that's just turned 65, or maybe he's 66 or 67, and his wife is 60. A good closing tool is, or pre-close, what I've always used is, Mr. Jones, since you are married, or I'm just using a married in this situation, doesn't have to be, but since you are married and your wife is not yet eligible for Medicare, we can still go ahead and give you the household discount of 7%, even though she's not applying here today. It's a good way to plant that little seed early to let them know, hey, the rate's 100, but I'm going to get it for less. Or maybe you've been in a situation before to where you walk in and maybe one spouse is in a wheelchair or on oxygen or has dementia. They're not going to qualify in an underwritten situation. You can still use that as a closing tool. Mr. Jones, we know that we can't make any changes for your wife's health insurance because of her health the way it is. However, you are married or you are living in a civil union partnership, we can still go ahead and give you the discount. So one person need to apply. Just remember there's a couple of states where 2 have to apply it, and that's Ohio and New Jersey, and in Idaho there is no discount. So I think Minnesota is going to fall into that category also when we get it approved. So there'll be 4 at that point, but right now there's just 3. Health questions, very, very simple yes, no application. It says do not answer questions 1 through 17 if you're in GI or open enrollment. But if they answer all the questions no, they are eligible for a policy. If they answer any of these questions yes, they are not. So very, very simple yes, no application. There's a lot of questions on there. But guys, it's standard questions on just about every app that you're going to see out there, unless it's an AARP, which is usually more liberal in underwriting. But if they're currently hospitalized or in a nursing home, all companies want to know that. We're not going to issue it. If they've got, if you go down to number 4, Alzheimer's or dementia, we're not going to issue that, or Parkinson's, something like that. If they have AIDS, we're not going to issue it. Go down to question number 6, though. I do talk about that. Do you have diabetes that has ever required more than 50 units of insulin daily? If they have, there's a good chance that we're not going to issue that. Insulin-dependent diabetics are very, very expensive. They doctor a lot, and there's a lot of complications that go along with it. If they have any of the following, neuropathy, retinopathy, or vascular disease, stroke, TIA, kidney disease, we definitely are not going to issue that. But there could be a situation that maybe they're on 55 units of insulin, and they've been on 55 units of insulin for 3-4 years, and they're not taking but maybe 1 blood pressure medicine, and they exercise, they don't smoke, and you think maybe this is a good case. You can answer that question yes, and submit it to the underwriting department with an explanation, or maybe call them and say, listen, I got a guy here, he's taking 55 units of insulin, he's taking 1 medicine for blood pressure, and that's it. He doesn't take any other medicines. This guy goes to the gym, he walks, he exercises, he does not smoke, he's height and weights and guidelines. Would you consider him? There is a chance that they will do that. They'll run a script check, and they will take a look at that. Now, go down to question number 7. If you have diabetes with high blood pressure, have you taken more than 2 medications for either condition? It doesn't say, are you taking 2? It says, are you taking more than 2? So you could have a person taking 2 oral medications. Maybe he's taking glyburide, and maybe he's taking Actos, or maybe he's taking one of these new drugs, Invokana, and maybe he's taking 2 like lisinopril and amlodipine for blood pressure. But he's been on those for 2-3 years and has had no changes. His blood pressure, or his readings are all stable and within norms. That's a good chance that will go through also. Once they go to that script check and they see that those medications are stable and they've been on them for 2 years or more, they'll go ahead and issue that. But if they go in there and they see, okay, you've been taking metformin at 500 milligrams, 6 months ago the doctor raised it to 750, then that's not going to be stable. They're going to say, okay, something's not working here, the doctor hasn't got this figured out yet, then that would probably be a decline. So they want those medications to be stable for the diabetics. Guys, go to the CDC website and just click on diabetics, and it'll tell you that diabetics are 2 times more expensive to treat than non-diabetics. So that's why we have to be very, very careful right there when we're talking about diabetics. The medical questions, or the medicine questions, there's 4 things on there. We want to know the name of the medication, the date it was originally prescribed, the dosage and frequency, and the diagnosis for which that drug is being issued. What we're looking for is anything that's been 2 years and out. We want to see stability in that medication to see if it's doing the job. So what I do when I'm sitting there with a policyholder, before I call into the underwriting department, if I'm face-to-face with them, I fill this out and put it right in front of them. I'll say the medication, let's say it's amlodipine. The date it was originally prescribed, I take amlodipine. I couldn't start to tell you when I started taking it. I know approximately. I know it was about the first year that Medicare Advantage came out. When we started enrolling everybody in drug plans, it was so stressful I ended up on blood pressure medicine. So that was about 2006. So I just write approximately 2006 right there. That lets that underwriter know that I've been taking that medicine and it's doing the job. The dosage, you need to put that on there, 10 milligrams 1 time a day, and what's it for? and I just put HBP, high blood pressure. And that way, when the underwriter gets on there, your policyholder can just read right down through there. You've discussed it, you've looked at their models, and they're aware of what they're doing and what's going to be asked. Okay, then that's just signature page and the producer's statement. You guys have seen all those. Standard replacement form, there's one in the app pack for you and one to leave with the policyholder. And so now with that said, guys, let's talk about how we go about submitting new business. Actually, we have 3 ways now. The third way is not quite available yet. We're testing it right now. Hopefully it will be available within the next 7 to 10 business days, and I'll talk a little bit more in detail about that. But right now, the 2 different ways that we have are face-to-face and a call center setting. Primarily, there's not a lot of difference except one, you're doing a 3-way call, the other you're sitting there at the kitchen table with your policyholder or prospect. So what are the benefits of the telephonic application? Why do I think this is something that you should be using? First off, guys, I grew up selling MedSup back in the 80s, face-to-face, the old-time way. We didn't have automatic claim filing or anything at all like that. The telephonic app, I would have loved to have had that back in those days, because when I'm sitting there face-to-face with somebody, if I'm going to get a decline, I would a lot rather know right then on the spot than to find out 2 or 3 weeks later and have to pick up the telephone and call my policyholder up and say, oh, Mr. Jones, I just heard from the insurance company, guess what, you didn't qualify, but now I'm going to be back over in your area tomorrow at 9 o'clock in the morning or Friday in the afternoon. Would either one of those times work for you? Sometimes that works. Sometimes it goes like this. Well, Bill, I hadn't heard anything. I got a little nervous, and I just went ahead and paid my other premium. I really appreciate you trying to help me, but maybe next year. So if you've been in this business for any length of time, I know you've heard something like that with the old-fashioned way of submitting business. So the immediate results of a sale or a decline is very beneficial for me and you. And if I get that decline, that means I'm already established the relationship. I'm here face-to-face with you. Let's take a look at maybe somebody like an AARP that has a little bit more liberal underwriting. Might cost you a little bit more than what I'm currently showing you, but it's still a lot less than what you're going to have to pay with this new rate increase. Just a lot of good reasons for doing that. Another huge benefit for you and I in the sales field when I say immediate results and time saver for both you and me is the fact that this is the 11th of March. Let's move down the road 2 weeks from now to the 25th day of March. Let's say that you're sitting there talking to a policyholder and they have disclosed to you that, boy, am I glad to see you. I just got a rate increase from XYZ insurance company and my premium's going from $170 a month to $210. If you've been in this business, you've heard stories like that. So, you already start thinking, boy, I got a good shot here to save this guy some money and make a little bit of money for my family and I myself. So I can help this person. This is a good deal. And he says to you, well, I got to pay this rate increase on the 1st of April. So even if I qualify for your plan, I know I'm going to have to pay that rate increase, at least one more month. Now you have the ability, guys, gals, to pick up that telephone and say, you know what, Ms. Jones, we've already went over the price. We went over the health questions. I think you're extremely good risk. I think you can get our product. Let's go ahead and find out right now. You pick up the telephone. You dial the toll-free underwriting hotline number. They do their questions, ask you your questions. They underwrite the policy. They issue the policy. You have a policy number. So huge time saver for you and I. That way you can go ahead and cancel the other policy. And I'll get into a little bit more about that here in just a minute. Another thing is that if you get a decline, you don't have to travel back and forth. You're already there. It's a good deal for you. One of the things that agents always like is how quick they get paid. If we approve a policy today with you right there in front of the policyholder, it's the first time you sit down with the policyholder and you get your approval, it just makes sense that policy can go right from that phone call to policy issue to the drafting of the premium. As soon as that premium clears, we get you paid. So we get you paid really, really fast. Another huge benefit for a lot of agents, including myself, hard to make a mistake on when you're doing a telephonic app, because the underwriter can't go from section 1 of that app to section 2 of that app until every required field is logged. So you don't have to worry about making mistakes on the application or missing signatures. Okay, so let's talk a little bit about the face-to-face process. The first thing, you're going to call 888-352-5158. You're going to complete your agent process. That will include things like what's coming on the screen now. They're going to want to know that they're going to make sure you're appointed with IAC and licensed in that state. If there's a problem with your license, that will not stop the interview. They will continue it, but at the end they'll say, oh, by the way, Bill, you need to get your appointment renewed in the state of Missouri. Your appointment fees are due. So whatever the problem is, they'll identify that and give you time to get it done. But don't think you don't have to act on that, because that policy will go into queue and won't issue until you get your required information done. So once you disclose your agent number, that will let us know that you are up to date and ready to go. They're going to ask your policyholder's name, the effective dates, the bank draft dates. Where do you want us to mail the policy? Do you want us to send it directly to you, the agent, or do you want us to mail it to the client? We'll do it either way on a per sale basis. You can pick and choose whatever you want done. A lot of times if I'm doing a telephone call, a three-way call, and it's toward the end of the month and I need to get a policy in their hands real quick for an ID card, I'll have them send it directly to the policyholder. But if I got plenty of time, a lot of times I have it sent to me. City and state that application is taken in, and the name of the carrier that you're replacing, if that is applicable. Okay, once they get your portion done, they're going to say, okay, Bill, go ahead and put your prospect on the phone. Now, at that point, guys, you remember that app we went through? Now the underwriter starts going through this application one step at a time. And I'm going to go through this. You've already seen it. They're going to ask everything. They're going to neatly type everything on this application. This application will be included in your policy when it goes out. And it'll, for you're supposed to sign, it'll say signature on file. So they'll start filling out the app. They'll go through part 1. They'll move to part 2. Verify that it is a Plan F or a Plan G, whatever you told them you want to sell. They'll verify the tobacco smoking question, and once they get all that in, that will guarantee the rate. It'll automatically fill in the rate. They'll go through the eligibility questions, all of that, everything that you see now on that app. Now the underwriting department the underwriter is going down through this application. Again, the correct answer for this question here, Part 5, page 3, is yes. They're guaranteed issue information. Let me back up for just a minute. When it comes to the guaranteed issue information, they will cover that. They don't necessarily go through step 1, 2, 3, and 4 in order. They will, if you tell them that this is a turning 65, they will tell your person that they qualify for open enrollment, and some of the things do not apply to them, so just disregard them. Whatever the situation is that they underwrite or get from you, if it's a fully underwritten question or application, they will cover all that with your policyholder. So, but they will cover everything on the app. They will get to they'll ask you, does the person qualify for a household discount? And if so, the name of that person and the relationship, and then they will verify that with the policyholder that, yes, that is exactly true, so that there is no cheating going on. They want to make sure that you tell them correctly. And then here is something that is Part 8, but if you look at Part 9, that is the health questions. So let me just give you a little heads up here. If you hear them going through the health questions and they go through the medication questions and they do not verify premium, you know that policy just got declined. But if you're sitting there listening on a face-to-face interview and you can hear your policyholder respond, in other words, they're answering all the health questions, no, and then they go through and they verify the medications questions, and then they say to your policyholder, okay, that completes the underwriting portion of the interview. Now we'll do the premium verification. Once she starts asking for checking account numbers and things like that, which you should have already told your policyholder they're going to do, you know that policy is issued. You know it's approved. And that is a good thing, but if you don't hear them verify premium information, you need to start looking in your kit for AARP or somebody else that's a little more liberal in their underwriting. So it kind of gives you a heads up of how the interview is going. Okay, so they went through the health questions, the medications, and we've already covered this diabetic stuff here on the app, so I'll buzz right through that for time's sake. Here is some questions in the underwriting guide that when you're talking to a person with diabetes, ask them just little teaser questions. Do you have any eye or vision problems? Ms. Jones, do you have any numbing or tingling in your toes or your feet? That's the neuropathy question, so you can kind of help identify that. And you ask them if they're ever having any issues with circulation or pain in their legs, things like that, if they are diabetic. Okay, at that point, they'll start doing the verbal signatures, the voice signatures. You don't have to have a wet signature on the application. We're working, I'll show you a way here in a minute to get away from the replacement signature. That's coming very quickly. Okay, at this point, guys, they're going to say, hand the phone back to your agent. They verified medications, and they verified health questions. They verified the banking, and they say, okay, hand the phone back to your agent. Now, guys, this is the most important part that you and I can do in the sales field when it comes to eliminating buyer's remorse. One of the oldest reasons in the book for people to get buyer's remorse is the time it takes the policyholder to get a policy approved and back. So when this part comes back to me, the agent, I never make a phone call on a policyholder's phone unless it has a speakerphone. If it does not have a speakerphone, I use my iPhone so that I can put it on speaker once the phone comes back to me. You can't do the whole interview on speakerphone. They'll tell you to take it off. But right now, the phone comes back to me, and I hit the speaker button because I want the policyholder to hear with their ears, not with me just saying it to them. You're going to hear things like, okay, Bill, the policy is okay, it's approved. Give me just a couple seconds here, and I will give you the policy number. So he gives me the policy number. It's 2896344. And I write that down. Where do I write that down? If it's a replacement policy, I write it on the replacement form because I got to get them to sign it and send it in. Okay, so I write that on the replacement form, 2896344. And he'll say your policy is effective on April the 1st. We're going to draft his bank account on recurring months on the 5th of each month, and the premium is $150 a month. So I wrote all that down, and at this point now, I'm going to read this back to the underwriter. So say I got Tristan on the phone. I say, no, Tristan, let me just read this back to you. My policy number is 2896344, right? That's correct. It's going to be effective April the 1st, and we're going to draft $150 a month on the 5th of each month after this first draft. Is that correct? Yes. One last question. Since we do not have any pre-existing waiting periods on our policy, would it be okay for us to notify her current insurance carrier that to stop that on April the 1st, not to draft her bank account in April? That's fine. She'll be covered under April the 1st, as of April the 1st. So what am I doing there? I'm letting that policyholder know you are approved. The insurance company's telling you you're approved. Here's your policy number. It's effective April the 1st. And at that point, I say, okay, Tristan, appreciate it. Have a great day. I hang the phone up. Now, I take it one step farther. I tell my policyholder, my new policyholder now, Ms. Jones, get your current insurance ID card out. Let's look on the back. There's another toll-free number on there that's for customer service. Let's call them, and let's let them know that you want to not have any premium taken out of your bank account on April the 1st. So we call the company up. I identify myself as an insurance agent in the state of Missouri, and I'm sitting here with Mary Jones. Her policy number is this, and she's got, here's the phone. I'll let you talk to her to verify that it's okay to speak to me. She'll at that point talk to the policyholder and say, is it okay that we talk to so-and-so after they verify she is who she says she is. And the phone comes back to me and say, you know, Ms. Jones just got your last rate increase, and that's more than she wants to pay. We're going to go ahead and ask you not to draft her bank account in April and to cancel the policy April 1st. And then I always ask, do you need a written letter with that authorization? And if they say yes, we write a little letter telling them exactly what we want them to do. And if they don't, we're done. So when I walk out the door, I've done things for that policyholder that probably 98% of all other agents don't do because they don't have the capability of what we're offering them. So it's a great, great tool for you and I to eliminate any need for buyer's remorse. They don't need to worry about whether they're approved. They heard it with their own ears. They don't need to worry about stopping their current bank program. We did that also. So that now I have established myself as their go-to person now and in the future. So that's important that you do it that way. You don't have to, but I'm telling you, it is a very, very effective way to seal the deal. Call center setting, not going to spend a lot of time on this, guys. The thing about call center setting is it's basically the same thing as a face-to-face. You're doing a three-way telephone call. You stay on the phone the entire call. You make sure you prepare the client. Do not coach the client, but make sure they're prepared for the interview, and make sure you're prepared for it. So if you've never done this Telephonic app, it can be a little intimidating when you very first start. However, it's not as bad, and when you do it the second time, you'll be better than the first. When you do it the fifth, sixth, seventh, eighth times, you'll get very good at it, and you'll make sure that, that you will do that now and in the future because it just speeds up everything. So it's a great, great way for you and I to conduct our business. We are introducing an online express application here real quick just to touch a few highlights of that. What really that is it's a great way to, for the old-fashioned guy that goes out there and he takes the app and he comes back to his office and processes it, sticks her in the mail to the company, and 2 or 3 weeks later he gets his answer. He now has the ability with the Online Express app is to come home, take that app when he comes home, and get on his agent website at iacagent.com, click on the Online Express application button, and now he can download, he can fill in it's like a PDF fillable application. You just fill it out, hit submit, and the thing that does, that guarantees that your policyholder will be underwritten in 24 hours. They will get a call back to from the underwriter within a 24-hour period. We sweep that account every 5 minutes. So once an app goes in there, if it's during working days, that will get to an underwriter's hand within 5 minutes. Great, great opportunity. It eliminates the need for the guy that's doing a three-way phone call to have to fill out the replacement notice. We're working on if you're listening from Illinois, as you're well aware, there's an Illinois checklist. You still have to have that filled out and get a wet signature on that. But with this Online Express app, the only signature that you will have to have is the Illinois checklist. The replacement form and everything else is available on the Online Express app. And I talked to Jose on the underwriting department. The Illinois Express app, or the Illinois checklist, is on the drawing board to get that fixed also. So we are working to make this one of the best processes out there. The guys that are using the Online Express app love it. We have it on another platform. We're testing it right now for IAC, and it should be available here within, like I said, 7 to 10 business days. Have any questions on that, get them into Todd or myself. We will answer them as we get through here. Okay, so just kind of what I consider a cheat sheet. I always put this out there for agents. Here's the things that you just got to understand that we're going to ask, and I think you can see what I'm getting at here. When the underwriter asks your policyholder for their Medicare number, if they have to go get it, slows things down. And then we start verifying banking information. They have to get up and get in their purse or go get their checkbook out of the car or something like that. Slows things down and frustrates everybody. Make sure they have their medications and their doctor's information readily available if you are doing a underwritten application. If you're not, we still have to have their Medicare number, their Social Security number, and their banking information, things like that. Make sure all that stuff's readily available. If you're prepared and the client's prepared, this telephonic application goes through smooth as silk. I've had guys send in all kinds of comments on how easy it is. And guys, let me just give you an example of how I use it to my benefit. I've got a lot of policyholders in the state of Missouri from the last 30 years. Some of them I have really good relationships with. Most of them I do. Some of them are deceased, of course. But what I'm getting at is I had a lady down at it's down in the Lake of the Ozarks area of Missouri, and I'm in Kansas City, so that's about a 2-hour drive to her house. And she had an old policy with Christian Fidelity she'd had for numerous years, and I'm tied up, swamped, can't get away. I called her on the phone, and I said, hey, Jerry, you know, I know you're concerned about your rate increase, but let's look and see what's available. So we found a good product like IAC. This was before IAC hit the market. It was actually with Heartland National Life that I was using for this process. And instead of having to drive 2 hours down to her, I went over the health questions with her on the phone, got her banking information and everything squared away, called the underwriting department. In less than 30 minutes, the whole thing was said and done. So that saved me a 2-hour trip down there, at least an hour and a half in the house talking, because Jerry likes to talk just like I do, and then a 2-hour trip back. So what would have took 5 hours of my time, I completed in 30 minutes. And guys, you and I both know, in this business, time is money. So great process. If you have any questions on it, or you know, you're a little bit intimidated about doing it, get your feet wet. Get out there and try it. I think you'll love the process, and it just gets better all the time. So, again, if you need any help with it, get a hold of myself or Todd. We'll help you also. The biggest important thing on this Telephonic app, do not coach the client. Let them answer especially you can chime in on things like their Medicare number or their address, or if there's things like that, phone numbers or things like that. You can help out with that. You cannot help out with health questions or medications. They have to be able to do that themselves. That's the HIPAA portion that's really protection. So in review, as you well know, we issue the policy right over the telephone. We give you a policy number. You save on time. If you're going to get a decline again, now's the time to know it while you're right there with the policyholder, so you don't have to drive back 2 or 3 weeks later and sell the same dirt over again, burn more gas and time. Guys, you can still use paper applications. Probably 50% of the business we get right now is telephonic. So we still do get paper, but a lot of the business is the telephonic app. If they do the telephonic app, it's issued in their policy. The app is in their policy, so they can make sure that they have a copy of that with them. And again, it allows us to pay you a little quicker. The telephonic underwriting hours are open Monday through Thursday, 12 hours every time zone, so we give you a broad range of when you can complete this process. If it's after hours or before hours, maybe you're on Eastern time and you're talking to somebody early in the morning, maybe it's 7, 8 o'clock in the morning, you can call the telephonic underwriting department and leave a message. Say, hey, this is Bill Ellsworth. My agent number is this. I'm sitting here with Mary Jones. Her telephone number is this. She wants to enroll in our Plan F Medicare Supplement. Could you call her back at around 11 o'clock this morning? Give us tell your policyholder to give us a little leeway there, and we'll get them called back. But on Fridays, it's 11 hours in every time zone. So we feel like that underwriting hotline is open to you for a good portion of every day. Okay, let's talk a little bit about a bonus program. We decided when we launched this program that we wanted to give agents reason to do business with us. And one of the things that agents always have liked is money. Imagine that. 31 years, I still enjoy seeing those commission checks go through and deposited in my checking account. So we have 2 different programs, LOA and brokers. LOA would mean a licensed only agent. So to define that, guys, most of you probably know what an LOA is. Sometimes it's determined different. But basically, an LOA is an agent that is working for an agency, and the agency, all the commissions go to the agency, and the agency pays the agent. If you're a broker, you get paid directly from the insurance companies. I can make an argument for being either or. I've been an LOA and I've been a broker. I know LOAs that make a lot more money than people who are brokers. It just depends on each individual situation and what that situation is. So we have 2 different programs. Either one of them are very lucrative, and they all run. We were just going to do an initial rollout for the first 30 days that you're contracted with the IAC, and then we were going to do it for another extended 90 days to offer more of a benefit. But guys, it's so daggone popular and it's working so well, we're going to extend this program all the way through 2015. So now till the end of the year, when you write IAC applications, we're going to pay you an additional bonus. I can't go over the numbers because I don't know whether I'm talking to LOAs or brokers, so it's different for each situation. But either way, we'll just give you an example. Last month we paid out over $35,000 just in additional bonus money, not including the already good comp on this product. This is a very competitively priced product. It's a very competitively comped product also. So we offer a good comp on the product, and we're also giving you a good bonus. We need you to do a really good job on the bonus because we've already talked with the reinsurers, and they said, hey guys, if this is really popular and you do a good enough job with it, we will extend it to 2016 too. So jump on board. If you don't know about the bonus program, call us after the webinar. We'll determine whether you're LOA or broker, tell you what you're entitled to, and we will move from that point. But guys, we want you to earn business. The owner of IAC is an actuary by trade, so he understands numbers. We have the national marketing rights here at Heartland Financial Group. The owner of Heartland Financial Group has been an insurance agent in the business for 30 years. He knows what you and I do out there for a living, and he knows that if he can get more money in your pocket, we can get you to write our product also, and our product is very well priced. It's good for the policyholder, it's good for the agent, and we want you to do a good job so that it's good for the company. So with that said, if you have any questions on the bonus programs, give us a call afterwards and we'll go over it with you. Contact information, agency services, you would get a hold of Cindy Laster. I'm going to leave this up here. I'm going to go by it and then come back here to it and leave it up if we have any questions. Again, there's my name. You can get a hold of me. My name is Bill Ellsworth. You can get a hold of me at bill.e@e-hfg.com. Todd Weiss is our regional sales director. You can get a hold of him at tweiss@e-hfg.com. Cindy for licensing questions. If you got agents that you want to contract, get a hold of Cindy in the licensing or agency services. And if you need supplies, you can do that online on your agent portal, and that would go to Amber Nevin at Agency Services. So anyway, let me go back to the contact information. I'm going to leave that up there. Todd, if you have any questions that you haven't already answered, let's go ahead and get those taken care of, and we'll let everybody get back to work.
No, Bill, we're good at this time. We had some basic questions on rates, and some people wanted the slides, so I will follow up with each person after this and get them a copy of the slides and rates if they need it.
Sounds great. Guys, appreciate you for joining us. Again, if you need anything, get a hold of us. We will do what we can to help you. And take care. Have a great day. I know it's 70 degrees, almost 75 degrees in Kansas City today. It's going to make it hard to stay here and work, but unfortunately that's what I have to do. But you guys need us, give us a call. We'll do what we can to help you. Take care. Have a good day. Bye.